Hello, everyone. Thank you for joining today's story webinar. Before we get started, we're going to go ahead and ask everyone to mute themselves just to avoid any background noise as we go through the slides. All right. Just letting folks in from the waiting room. All right, let's get things kicked off. So thank you guys so much for joining us for today's Share Your Story with Policymakers webinar. This is part of the training for Rare Across America 2024. So we really appreciate you guys all being here to learn more about sharing your story with your members of Congress.
All right, great. That sounds perfect.
All right, so during this webinar, here's what you can expect. We are going to talk a little bit more about what to expect in your meetings and how to prepare. We are going to refine your elevator pitch or your story and develop a clear and concise ask. You are going to receive tips and coaching from other rare disease advocates in the space who are experienced and have done these meetings time and time again. So they are going to help give you some tips on how to share your story with impact. And we hope that this is helpful for you today. So let's get kicked off on how to prepare for your meetings. So before your meetings, it's really important to get to know your legislator. It's important to understand your legislator's role in the bill you are asking them to support. So for example, it would be important to understand what committees your member of Congress is a member of or that they lead, as well as what bills they may have introduced. So if they've introduced any kind of healthcare legislation that's relevant to the rare disease community, this is definitely something that you want to thank them for when you go into your meeting. It's also important to understand their platforms and their views on the issues or bills that you are asking them to support. So going on their website, understanding a little bit about their healthcare portfolio and what bills they have either introduced or supported in the past is going to help you kind of understand a little bit more about your member before the meetings. And then, of course, looking at their social media channels will be a nice, quick, and easy way to gauge kind of what the office is working on, what their priorities are right now. And then we do also have legislative scorecards that you guys are encouraged to use for your meetings. You can go on there, find your state scorecard, and see how your members have voted or acted on policies or priorities of the rare disease community throughout the past year. All right, so some materials that you will want to take with you for your meetings are listed here. One thing that we recommend is putting a few bullet points down for yourself about what you plan to share. Just bullet points of those highlights of your story that you want to make sure you don't miss when you are in your meeting. Of course, your story or your elevator pitch, which we are going to work on today. Any supporting materials that you may have are important to bring with you as well. This includes one-pagers on each of the asks, which I'm going to talk about in just a second. And also any materials that are related to your community. So if you have a brochure on your disease type, that's always something that's helpful to share with them as well. And for the one-pagers, we're going to talk about the legislative ask in a couple of slides. But before we get there, while we're talking about materials, I want to remind you guys that we do have one-pagers on each of the legislative asks on the RDLA website. Before we go into the ask, I want to make sure that you all know you do not have to use these bills as your ask. If you are interested in making a different ask, maybe your community is leading a different bill, you're more than welcome to make that bill your ask. We just ask that you bring a one-pager on that bill with you. So you can look and see if other organizations maybe have already created one, or we encourage you to create one yourself if you're not able to find one. So what your legislators expect from you. So when you go into this meeting, your legislators expect you to be informative and concise. This is important because your meetings, as you know, are limited in time, ranging anywhere from 15 to 30 minutes. And the members or staffers that you're going to be meeting with are doing these meetings all day. And so it's important to respect their time and to respect the time of the others who are in the meeting with you. Your members expect you to be accessible, creditable, and reasonable. So, for example, when you go in to make an ask, your ask should be something that the member of Congress can actually do. Of course, I'm sure we have dreams of things we would like them to fix, but we have to be reasonable with our ask. They expect you to have a sense of their role in Congress, as well as their platforms and views. So, for example, if your member of Congress is on the House Energy and Commerce Committee, that would be important to know because they do handle a lot of health-related legislation. And that would be important to know before meeting with your member of Congress because it gives them a bit of a different scope when considering this, whatever your ask may be. They also expect you to show how the problem applies to them and their constituents. So when you are sharing your story, this is where statistics become very powerful. Of course, it's important to share your story and your experience with rare disease, but their question is going to be, how many people are also affected by this? And so we have a great sheet on the Rare Cross America website with some statistics there for you that you are more than welcome to use. So highly encourage you to check that out. They expect you to be prepared with your one-pagers. So whenever you make an ask, you should have the one-pager for that ask with you so that you can leave it behind with the office. This is important because, like I said, they're doing meetings all day with people asking them to support all different kinds of bills and initiatives. So leaving that with them will help them to remember what you talked about and will help them in relaying everything that you shared with their boss if you are meeting with a staffer. Going into meetings, I want you all to remember that you are the expert on your experience. You are the expert on your rare disease. And you may be meeting with folks who are not, who have never met someone with a rare disease before. So that's why it's very important to share your story and to be authentic. There's no need to, memorize a script or anything like that. Just go in, be authentic, be respectful, and share your story with your member of Congress. All right, so we are going to talk a little bit about message delivery. So when you are going into your meetings, you are sharing your story with your member of Congress and asking them to take action to help with whatever the challenge or the issue is that you're having. So in these meetings, it's important to remember that you are in the driver's seat. So like I said before, you are really the expert on your experience. You're meeting with someone who may not be educated on rare diseases. And so it's so important to share your experiences and the challenges that you may have faced with them. It's also important to balance fact and emotion. We totally understand that sharing your experience or your family's experience with rare disease can be emotional, especially if you may be sharing these things with someone for the first time. But it's very important when you are sharing to also balance fact with that emotion. And that's where the statistics that I mentioned earlier come in.
Mm-hmm.
And it's also
Yeah.
important to remember that in these meetings, less is more. So you want to really hit on the high levels of your story. So for example, you don't necessarily need to get into the details of maybe every doctor visit you've had or specialist visit you had, but it's important to hit on those high points that really emphasize your experience. So, as you are crafting your message and thinking about what you want to say to your member, it's important to think about it kind of in this format we have laid out here. So, thinking about first what your problem is, second, what the solution to that problem could be, and then lastly, your ask. So, we are going to have Bailey McGowan from our policy team talk to you a little bit about developing your ask to fit with each of the recommended legislative asks for Rare Cross America in that problem solution ask format. So Bailey, I'm going to go ahead and turn things over to you.
Awesome. Thanks, Caitlin. Hi, everyone. It's great to see you guys. So these are the 3 Every Life supported asks for Rare Across America. So we have Accelerating Kids Access to Care Act, Help Co-Pays Act, and the Creating Hope Reauthorization Act. And on the next few slides, you'll see it broken down into that format. So if we just want to go ahead on to the next one. So kicking off with the Accelerating Kids Access to Care Act, or HR 4758 and Senate Bill 2372. I will say, if you guys can, when you go into the meetings, if you note the bill numbers, it's always really helpful for the staff because then they don't have to go look it up. But as we know, expert care providers for every condition are not readily available in every state. A lot of the times patients will have to go out of state to really get that expert care. And for Medicaid patients, in order for that visit to be covered, the out-of-state provider would need to become a part of the patient state's Medicaid program. And it can be a really lengthy and time-consuming process. Some states are still on snail mail for this process. It's not even digitized, and that can take months. So a solution for this would be to establish a federally streamlined screening program or enrollment pathway that would be totally voluntary and opt-in for providers, so long as they are in good standing with their own licensure. And that would allow them to or patients to access these expert and out-of-state care providers much faster and really get the quality of care they need in a timely fashion, or a more timely fashion. So the ask would be to co-sponsor the Accelerating Kids Access to Care Act, which would help create this federally streamlined process. That one is only for youth patients on Medicaid, just to be clear about that one. So then we can go ahead to the next one, which does help everyone. This is the Help Ensure Lower Patient Co-Pays Act, or the Help Co-Pays Act, HR 830, Senate Bill 1375. Again, as a lot of us know, rare disease therapies come with quite a price tag, and a lot of times patients will turn to charitable or manufacturer copay assistance to really help offset the cost of these therapies. We've seen with increasing amounts over the last few years that the manufacturer copay assistance, or the charitable copay assistance, sometimes called third-party assistance, isn't being counted towards a patient's out-of-pocket maximum or deductible for the year. And so a patient will get to the pharmacy counter and have an astronomical bill when they thought they've already met their out-of-pocket maximum, and are really faced with the tough decision at the counter of, do I spend money I may not have on my medication or go without? And neither of those are really options for people. So the solution would be to instate the Help Co-Pays Act, which would require health plans to count the value of copay assistance made by any party, so the patient or a third party, towards their out-of-pocket maximum and their deductible for the year, to really just ensure that patients can access their own care and quality of care. I think that's it for the Hope Co-Pays Act. And then we have the Creating Hope Reauthorization Act, or HR 7384, Senate Bill 4583. Therapies can take a really long time to develop, and then once they are developed, it takes about 10 months to go through the FDA approval process. So some really smart people a long time ago created the Priority Review Voucher Pathway, which is a program that allows therapies, in this case rare disease therapies for pediatric patients, to get a voucher there's quite a few qualifications that go with this, but the main one is that they serve the majority of the population served by the medication is under 18. And this voucher allows the company to knock about 4 months off of that approval timeline, taking it from a 10-month approval process to a 6-month approval process, which can be huge for getting a therapy to market. Another really cool part about this is that the company can actually sell that voucher to any other company. It doesn't have to be someone developing a pediatric rare disease therapy or rare disease therapy. And the average sale price of that voucher right now is about $100 million, which can be really influential and really helpful in helping a company get across the finish line and finish developing that therapy, getting it to market, getting it to patients. Unfortunately, this program sunsets every few years, and we're coming up on the sunset for this program now, so the end of this September. And if the program's not reauthorized by then no more PRVs can be issued after the end of September of 2026. So the solution is to reauthorize the program using or by really co-sponsoring and moving through the Creating Hope Reauthorization Act. And if anyone has questions on sort of what conditions and therapies have been authorized or have a PRV that's been authorized or sold, NORD has put out some really great reports, and then our own one-pager is really helpful in understanding some of that as well.
Awesome. Thank you so much, Bailey, for walking us through each of these and kind of helping folks understand what that problem solution ask format looks like in practice.
Yep.
And like Bailey said, if you have any questions about the ask, feel free to reach out. We're happy to answer any questions that you have. And now we are going to move into the actual practice session of the webinar. So prior to today's webinar, you should have received an email with each of these sheets. They are great to help you practice what you might want to say and think about how you want to share your story. So if you have not checked these out, they are also on the Rare Cross America website, or they are in your inbox. But like you can see here, they help you kind of think about what problem you want to talk about, how that problem should be addressed, and what your ask is. We also have this great script here where you can fill in information based on the notes under each of the lines, which I promise is easier to see if you print this paper out. And then we have a tip sheet here on things to think about and how to get ready to share your story with your members.
Did you say those were mailed to us?
They should be in your inbox. Yes,
Inbox?
they are on the Rare Cross America website.
Thank
you. Yeah, of course. So now we are going to go into our breakout rooms. So for these breakout rooms, each one is going to have a lovely coach. Like I said before, coaches are either members of the RDLA and Every Life staff, or they are advocates who have done these Hill meetings time and time again and have really great expertise to share with you all. So first, our coach here is Shanna Hudson. We also have Nisha Trivedi, Leah Campbell, who is going to also have our lovely RDLA intern, Nate, helping out. Our next coach is Paloma. We have Priscilla, Kelly, James, and Kinley. So you all have great resources here in these folks. Be sure to share your story with them. They are going to provide you with tips and feedback on how to improve, as well as point out the things that you do really well so that you're sure to keep those in for your meetings as well. So some things to have on hand as you go into your breakout room would be those worksheets that we just looked at, as well as one-pagers for any of the asks. Once I click this button, you will automatically be placed into a breakout session. Just be sure to click join to enter the breakout room. Again, if you're interested in participating in this portion, Please let your coach know. Please volunteer to share your story once you're in your rooms. And then following the breakout sessions, we will all come back in here together and share some takeaways. So don't leave once your breakout room is over. We will be coming back here. So I'm going to go ahead and break you all out into your rooms now. You should have just had a window pop up that says join. Go ahead and click that. All right, and so we're going to share just a couple of key takeaways from our breakout rooms. So coaches, if you have any key takeaways you would like to share from your breakout rooms, maybe something someone did really well that you'd like to share, or just a general tip, coaches, go ahead and unmute yourselves and share some key takeaways from your room.
I'll go ahead and go. I mean, my room and we spent a lot of time getting to know each other, so my apologies there. But I think in listening to everybody's introduction and story, I think the really awesome thing is picking out what is a part of your story. And there were a couple that we were able to touch on that is really that piece of nugget, that glean. I think when you tailor these, you know, it's really thinking about your story and what is that detail and be consistent with that detail in every conversation that you have. So there was somebody talking about the experience they had with a surgeon who really went above and beyond from another state, changed license just to come and train a group and provide a service for their child. That is impactful. It deliberately goes to the extreme and extraordinary circumstances of why access to care matters. So in thinking about your story, find that detail and use other people, share that story and see, hey, this is my ask, but this is my whole story. What kind of goes together? And that person can be, I've left my email there. I love to work with my best friends, you know, here's the ask. What do you think about like our life and journey really applies to that? And then how do I get that information in a very confident, concise, not going as fast as possible, but very detailed about that and integrating it with your ask.
That's great. Thank you, Paloma.
Sounds good. I'll go next. I had a great group of people in my session as well. It sounds like they all shared their story before, even though like, some maybe have been first time. But what I got was they all had their clear acts. Many of them came with their own acts, and it was clear and it was concise, and they got to the point. So I knew what they were asking, and I had some people. Jake, one of them, was in my group. He shared his story and it was authentic. They all had authentic stories, but what I like that he shared is he's asking for updating SSI, so it just can affect a lot of people with a rare disease. But he made it a point that if he works, he can't get his medication. If he works, it makes too much, so then he can't get his medication. So then he's back to being sick again or in needing treatment, and then he has to stop work. So it was very clear, and I definitely was able to relate to the stories that were being shared. So I think having stories like that and also having the burden of economics put into your story so that they have something to point to was very good for the group that I was with and can be beneficial to all.
That's great. Thank you.
And I mean, everything that that was already said, but I also appreciated how people shared their conditions or their stories in a way that could be understood by a non-scientific audience, because that is very much what the the legislative staff is. So I think really relating and saying it's almost like having this or that, or here's some of the things we struggle with day to day. I think that's really powerful because then they can put themselves in your shoes. And then the other thing is just making sure it's as closely tied with the ask as possible, so that there's no doubt what the person should do once the meeting is over, what action they should take as a result of hearing your story and the story resonating with them.
Well, was it Central? What time zone was it?
Thank you.
In my group, we had some really great stories, and there was a lot of cases where there was both personal and professional overlap in the rare disease space. So that was, I thought, like a strong point for them to make. And also they told their story in a very compelling and heartfelt way. So if they were part of, say, an NIH study or a natural history study, they mentioned the positives of that. And so they weren't just asking for something, they're showing something that the government's already done to help in their case. So it wasn't just sharing their story, it was also thanking them for something and then going forward. So that part was really good. But yeah.
Great.
So we had a great group of advocates in our breakout, and they all had some wonderful stories to be able to share that many of them were exactly what needed for these bills to be, to be impactful. And one thing I was wanting to make sure I told them is, great stories and great storytellers can not only just change their minds, but it can change their hearts and inspire change. And so, even if in the meeting, in those, few minutes that you may have with them, you're not able to get everything across, you're so short on being able to share the entire picture of your story and how these bills would definitely impact and help you in the future, to be able to follow up in emails and elaborate a little bit more, in maybe a one pager on your story, so that they can actually, get to know you a little bit more than just 90 seconds or 2 minutes, on a screen. That we always have way more that we want to share than we're able to in an actual meeting. And so following up is very important, to be able to complete the story and to share all of those other parts of the story that are very important, that could help to change minds and to, change hearts and inspire them to do something about it. So, but yeah, we had some great advocates there ready to go.
Good. That's always good to hear. And those are all great tips, Shanna. Thank you.
I'll just pop in. I was so impressed by how the members of my group were able to take a really long, hard journey that they've been through and pull out those key details that really tie into their ask and show how important and how impactful a legislator's support could be for those asks. So I thought that was so impressive, and they were fantastic about, asking the legislator for questions and keeping that conversation going and establishing a relationship moving forward. So amazing job, and so sorry for anyone that wasn't able to go. Please reach out to me if you didn't have the chance to.
Yeah, I like that tip, Kinley. I want to reiterate something that Kinley just said. At the end of your meeting, or once you've made your ask or shared your story, it's always a great idea to ask the staffer you're meeting with or member that you're meeting with if they have any questions for you. This is a really good chance to find out kind of what they're thinking after you've shared your ask, and a chance for you to answer any questions while you're readily available, and just fill them in with all of the information that you need while you're there. So if you have time at the end of your meeting, definitely be sure to ask them if they have any questions for you guys as well. Great. Well, we want to encourage you guys to take what you've learned from today's webinar and practice with yourself at home. A couple of different things you can do is use your phone to record your pitch and listen back to it, kind of see which portions you think sound really good or what maybe you think could improve. Things you could think about is, how did this feel? Was it brief enough? Am I speaking too quickly? Am I repeating parts of my story? And all you want to be sure to include a call to action. So practice, note what to change, and then go for it again and just continue to practice until you feel really comfortable with what you want to share. And of course, a thank you to all of you guys for being here, and a huge thank you to all of our coaches for being here today to share their expertise with us. We appreciate all of you for signing up to take place or to take participation in Rare Across America. This event is a great touch point after Rare Disease Week to meet with your members and remind them about the ask that you had, to make more asks, to thank them for maybe what they've done in the time since Rare Disease Week. So these meetings are really important, and we really thank you guys for meeting with your members of Congress to advocate on behalf of the rare disease community. So thank you guys for all of the hard work that you're doing. And if you have any questions about Rare Disease Week, anything to do with Rare Disease Week at all, schedules, ask, feel free to reach out. One quick note is that you should have all received an email this Monday, this Monday, the 22nd, with a link to your meeting schedule. So if you did not receive that, please reach out to me via email, and I will be sure to have it resent to you all.